So as you can see here, this is Ricky had a severe right-sided leg pain, which he said was covering the anterior part of the thigh and also the right hip. His MRI was significant for a herniated disc, which you can see is at the L3 level. And he had also positive nerve conduction testing showing me that he had nerve compression at the L3 level. Now, let's talk about a little bit about the medical mechanism of radicular pain. And when I say radicular pain, I'm talking about nerve compression. I'm talking about the leg pain that the patient is experiencing, the cramping sensation, the numbing sensation, the tingling sensation, the loss of strength on the extremity, and it basically affects them more during the night. They're not able to sleep. They're not able to enjoy life like we usually do, or work out, or do their daily chores. But let's talk about the mechanism. The mechanism is very simple. What you have here, you have a disc which actually herniated. When I say herniated, you got to compare this to a tire that gets a bump. So all of a sudden, or should I say also a donut. When I go to court and talk about this as an expert witness, I always say it's like a jelly donut. Once you take the jelly and it protrudes out of the donut, you can't bring it back in. It's physically impossible. So what happens now? You're actually compressing the nerve that comes out of the spine. And remember, every nerve has a function. The L3 nerve, in this case, it innervates the L3 dermatome. When I say dermatome, I'm talking about the area in the leg that it supplies the motor and sensory sensation. And what happens is now you have compression of the nerve causing inflammation. And as you know, inflammation causes buildup of substances that actually start irritating the nerve root, and the patient starts experiencing the pain. Now, how do we fix the problem? It's actually very simple. Normally, the body does it by itself if you wait long enough, but sometimes it doesn't. And what it does is it starts creating what they call scar tissue around the nerve root. And so after 3 months of pain, the pain becomes chronic. So now you got acute pain, 3 months later, chronic pain. So how do we remedy the problem? We start by having the patient start physical therapy to actually relieve the stress in the area, to increase the circulation in the area, and to increase the mobility. If the physical therapy doesn't work, we start him on some kind of anti-inflammatory. We also start him on some muscle relaxants. And if that doesn't work, then we try to go into painkillers. But painkillers are a short-term remedy because you don't want to be the rest of your life on painkillers. So in my specialty, which is pain management, I do what they call interventional procedures. What does that mean? Or what does that entail? I want to be able to have access to that irritated nerve root, and the only way to have access is to actually put the medicine where the problem is. And in this case, with Ricky, I was able to put a needle right close to the nerve root. I was able to deposit the medication at the nerve root, which is a potent anti-inflammatory with a local anesthetic. And what it does, the anesthetic stabilizes the membranes, and the anti-inflammatory reduces the inflammation around the nerve root, so the symptoms subside.